Hi, my name is Valerie. I'll be demonstrating the skill of meeting with the supervisor regarding criteria for member selection of a group. All right.
Hello, good morning. How
Hi,
are you? Nice to
see you again.
How's
How are
it
you
going?
doing? It's going good. I was able to get some selection criteria put together for the group we were talking about.
Okay, let's discuss what you've got.
All right. So basically, in this substance abuse treatment center, a lot of the case managers that run their own co-ed groups have found that there's members that have experienced significant trauma. And some of these members, they're reluctant to share because, not all the members have experienced trauma. So a lot of our case managers have been coming to us saying, I think we need to start another group that deals with substance use as well as trauma. So based on that feedback,
You're right, because a lot of people are trauma is something very serious, and a lot of people don't feel like discussing it in a large group. So sometimes it's not suitable for everybody to discuss their trauma. So I do understand that. That's great. That's
definitely.
great. I like that.
it can definitely help us when we're treating the substance use. 'Cause
Definitely.
it
Yes.
is connected.
That makes great sense.
And also the majority of these clients happen to be female. So I'd like to make one of the criteria like gender specific, being that majority of them are women. We would start a women's substance use group that focuses on trauma. For the sheer fact that obviously if it's co-ed and the women have been abused by a man, for instance, like they may not want to share if a man is in the room. So obviously the therapist would have to be a female as well.
Okay, to start out, that makes great sense. I see where you're coming from.
Yeah, and I'm not screening for like a criteria of age or education or background because obviously we're short-staffed. We can't have a group for every single demographic, right?
And then I'm sure diversity will come from different aspects
Exactly.
of the females or women that you'll be interviewing, because you could take them from different socioeconomic backgrounds, and let's see where that goes.
Yeah, definitely
That
can
sounds good.
offer some more insight, experience, perspective, but at least they all have that common bond of having experienced trauma. The good thing is these people have already been identified, because in addition to group therapy, the case managers interview these people periodically throughout their treatment to see how they're doing, voice any concerns they have. So the case managers have already identified candidates.
That's good. Let me ask you a question. How are you going to come up with these screening? Are there pre-screening tools?
Actually, yes. We have some tools. Originally, before we use those tools, in the interview from the case manager, the individual one, we've already excluded whether or not they're violent or hostile, if they have psychiatric conditions that can impair their cognition or ability to share. Also, there's some that refuse to do groups, so they need just individual services. But there are some tools that I found. I provided you with the articles that support them.
Yes, I was just looking at those.
We can put these in our toolbox, but there's only one that I want to use for now. So there's the Quality of Object Relation Scale,
Yes, that's a good one.
and it assesses personality pathology to determine if they're suitable for group psychotherapy and what their outcomes might be.
Excellent.
The next one is the Psychological Mindedness Assessment Procedure. It predicts patient response, such as remaining in therapy and engaging in therapeutic work. The Coherence of Relationship Theme, it just measures the degree of capacity for interaction and relatedness. And the one that I want to use is the Group Selection Questionnaire, which is predictive of group processes, group outcome, and attrition. This is very brief, so I think it would work best for us because they've already been evaluated by the case manager.
I like
So
that
this
one.
one's brief, quick,
Yes.
less overwhelming.
Yes.
And if we have problems with group functioning or participation, we can pull those other tools out for further screening. So yeah.
And one more question. How many people did we recruit for?
So far we've identified about 15.
That's excellent.
The last thing that I'd like us to consider is therapist factors. There can be counter transference if
Yes,
like the
definitely.
Yeah, if the therapist has also experienced
Yes.
trauma, that can be an asset or a liability.
Yes.
So we would definitely have to screen the group leaders to make
Mhm.
sure that, we minimize that possibility. The literature, another article I found
Yes.
states that the management of this countertransference is related to better therapy outcomes.
I think it sounds good, and it will be a good, I see that you have done your research, and you have done exceptional with selecting the group, and the one tool that we decided to use, which sounds very, very reliable,
Mhm.
so let's do that.
Awesome, thank you.
All right, nice seeing you again.
Nice seeing you.